Okay, so the problem resident I had in mind was something I'm facing right now as we speak. Back home, there are some residents like this. So these are real life experiences, could be one or more than one resident like this. So I've called my presentation the problem resident, the one who needs to be taught from scratch each time, every time. So there are knowledge-hungry residents who have extraordinary retention. They extrapolate concepts taught in lectures to other case scenarios. They observe very keenly and while assisting. Also, when they are doing the surgery, they require little to no help. And they proactively present and write papers and offer to help also for ongoing projects or take on new ones. So this resident is in second year, for example. So there is OPD clinic going on and the consultant can be me. So I tell the resident, you've seen this case and you've said there is aphakia, but there is an IOL in the sulcus. Please look carefully next time. So the resident says, yes ma'am. The next week, again this resident, if he's posted with me, if he or she, so I say, you've written IOL in sulcus in your notes, but there is an iris claw lens. You've seen iris claw lenses before, haven't you? And the resident says, yes ma'am, I have seen, I will look more closely here on. And they're like, okay, I'll look at it. 1 month later, you've noted the lens status as pseudophakia, but the patient is aphakic. Could you please spend a few more seconds on the slit lamp? You keep making mistakes like this. Lens status is very important for management of any ocular condition. Can you not please make the same mistake again and again? This time, there's just a nod. Then 3 months later, there is an IOL, that's what they have written. IOL is subluxated inferotemporally, but when I see it is inferonasal subluxation, I say, you've noted subluxation wrong. Now they just avoid my gaze. They just face me with silence and start walking away. So the general behavior of this resident or residents are that they usually keep silent in lecture halls, and when asked a question, they stall. They know we will move on to another person. And they don't assist very well. They keep being told to irrigate or to retract something or pass instruments, and they seem distracted for the crucial steps. Like when you're doing a crucial step, they kind of don't seem to be paying attention. Also, they demonstrate almost disregard for our methods. They have their own new way of doing it, as if you've never seen seniors doing that step. And they do this again and again and again. So my special effort for such a resident is, for example, I ask them what is scleral buckling. They say, we put a 240 belt, pars plana vitrectomy. I'm like, what? And there is silence. And then I say, okay, read about buckling, write the steps, we'll discuss tomorrow. Read, say, Payman or some standard textbook, watch a few videos, so it will get cemented. Then they'll say, yes, very good. They're just glad to have gotten off the hook at that moment. Next day, unfortunately, they are posted in my OPD, and they look nervous. No prizes for guessing why. We go about the day, and the end of OPD, I ask, did you read about buckling? They say, no, ma'am. Then I say, why? Because I was reading for cornea class. And then I would say it would take you 15 minutes to read something like on iWiki, or you could have just watched a couple of videos to just come and start a conversation about buckling. So when will you read? I'll read. Next week, in the OPD, young phakic patient with detachment. They'll write some plan like vitrectomy and silicone oil, just basing it off some random knowledge they have gained just by being around retina people. Then I say a young phakic patient needs to be buckled. That is the key word, buckling. I even told you to read about it. They say, okay. So now my efforts in this direction, and I would like others' opinion on this, I probe. So what do you do when you get home? And they like, I get home by 8:45 in community postings. Then I say, but you're in retina since a month, you get off at 7 p.m. Then they'll say, yes, but I'm preparing for a seminar. but that seminar is 6 weeks away. I say it only takes 30-40 minutes to read a topic. At least the basics can be read from AAO series easily. Then they say I get tired, my family has come, I was on iCall, I don't have those books. And then my more sustained efforts. So I immediately send an e-copy of the books, tell them to go to the classroom in the middle of the OPD. I say take 30 minutes, read scleral buckling from a source of your choice, come back, make a few bullet points and tell me what you know. And they do it. And we happily discuss buckling for the next 20 minutes. But a few weeks later, in class, during a case presentation of retinal detachment, problem resident will, now I say randomly that problem resident will tell us about the management of this case, because I'm so confident that we've spent so many days and minutes of deliberating about why they didn't read, and finally you gave them time to read and they did. And now you're very confident that they'll be able to rattle off about scleral buckling. But then they stall and then, ma'am, and they keep staring at the screen. And then, but I say, you read this just a few weeks ago, we discussed this. So what I have surmised is that they're a little nonchalant, they're not invested in the residency. Emotionally also, it requires a lot of emotional quotient to be invested in residency, to be invested in learning. And for some reason they feel like they just have to pass the exam, and for that some reading at the end is enough. They seem unaffected by questions asked to them about the subject, and they seem unaffected by their inability to answer also, or getting told the same things repeatedly. Is it poor retention? Is it low interest? They're definitely not unintelligent. So the same about surgery. They get stuck on the same step every time. They get told to assist well on the same steps. So my question to everybody is, how do you manage this problem resident?
Is this a fellow, post-PG or a resident?
So this is a fellow in mind, but the same can be said about residents as well.
What I feel is he is a resident and probably he was willing to have surgery or medicine or something else and has come in ophthalmology without choice.
Yeah.
He was forced into ophthalmology.
You're right. I always say this, many students, they get ophthalmology. They don't take or they don't choose ophthalmology, they get ophthalmology after counseling. You know what I mean. It's like they didn't get medicine, surgery or OBG. So they get ophthalmology. So that kind of, I think the entry level students are the average, according to the PG entrance test, they are average, the entry level students. I don't know, I mean, I surely cannot make a generalization, but.
Yeah, so Dr. No, I think one of the other thing that, I don't know whether you did it or not, but in the second instance itself, these kind of problematic residents require a frank conversation in a kind of a safe environment. Many times, I think there are other factors which are contributing to the poor attention. The second is that I think they have to be told in no unclear terms that a good clinical examination is must. And if they are not doing, we should not ask them to examine patients. And they can be taken through a retraining as far as the slit lamp examination is concerned. Third is that I think there should be some goal setting that have to be done in consultation with them, because they cannot be treated on the same line as the well-performing. Otherwise, they will constantly lag behind. Their goals have to be set based on their competency, not as per the other. These are three important things, because you might give them one exercise, they may do it, but the problem is somewhere else. And we need to probe deeper into what are the circumstances in which they are working. And one of the cause could be what he just narrated, that they are not interested in. And then if they are not interested, they can be told that they probably have no place in this residency program as well.
Excellent points, Dr. Prashant. And I was just going to add, I go as visiting professor to Ramchandra University. So, and I have committed to doing the OCEX for all their residents. So the last one, which I did about 2 weeks ago, so his confrontation fields was more like doing some Bharatanatyam dance. I said, I have sent you a video of how to do fields. And I looked at my WhatsApp because we have a group there. And I said, 23rd November. Did you even watch it? He said, no.
Exactly.
I have not watched it. So, but otherwise, he's a very obedient resident, well behaved, very respectful, very good with the patients. So I just stopped the examination, had him sit down, and then said, I can tell you've just not been reading. You've not bothered to study at all. What is the problem? Is it because and I know he got married only, 7 or 8 months back, and his wife is in another center. I said, are you missing your wife? Is it? And then he just opened up. Like you said, you need to have a frank conversation which is not confrontational.
Yeah.
I said, you can tell me, I'm here to help you. So, and then he opened up and said how, he and his wife, they talk for hours together. And then his parents don't live here either. Then he talks to them, and then finally when he opens the book, he says he just is tired and he's just overwhelmed every single time. At Shankar Nethralaya, what worked in this type of scenario is to appoint a mentor for other than a goal setting, because you cannot take care of everybody.
Right.
It also depends on the size of the program. You could appoint either a junior faculty or a fellow as a mentor for the struggling resident, and set goals and timelines, make them all noted down. We are going to revisit this in 1 month, put it in your calendar and be serious about it. So they know you're not just doing this, going through the motion. I think something like that might help.
Very good points.
Inherently in India, we are fearful or at least aware of exams. So periodic structured assessments can be one tool that may motivate them to study. So I remember at SN we had monthly exams, and even at LVP during fellowship we had open book exams, and so whatever it is, forcefully we would end up reading something. So.
But I think the kind of candidate that we are dealing with require a lot more of psychological help rather than a fear factor. And at times such residents, if you threaten them or make them more afraid of, may break completely, and there may be underlying psychological or medical causes that are resulting in poor performance. Therefore, I think if you consistently see the resident not making a correct judgment on the very simple, straightforward thing, it requires a very serious discussion to explore the underlying cause.
It always reflects that there is something deeper going on. It's not just lack of interest or lack of knowledge, or it's something deeper. By the time they become a fellow, especially, they have been through enough of the grind to know that there's no point in going through the motions.
Right.
And fellowship is something they join willingly. Usually.
Exactly.
Right? So yeah, it might just need a frank conversation and some help. We've had residents and fellows whom we've had to send to the psychiatrist, actually.
No, so have
Yeah.
we. So some of them came up with, I have insomnia, I'm not able to sleep, I just can't sleep, so I'm always a little preoccupied and stuff. And one more person I found out had lost a family member recently. So yes, those things do happen. But some of them are just nonchalant, even if you sit and talk to them, and it doesn't seem to make any dent.
What they want, only that particular thing they'll do well. Other things, it doesn't matter to them. They may not pay attention. I face the difficulty when the retina fellow posted and they want only, and UBA they try to neglect. And when they move out, then they have a query and they'll send the case scenario, what's up, my inbox will be filled. So in that way, what I tell them is first I'll try to counsel them what the problem they have,